Hey class, in this video we are going to introduce another category of the stroke, the hemorrhagic stroke. From the name of a hemorrhagic stroke, we will understand immediately that this type of stroke is due to bleeding. It contributes 10 to 15% of all stroke. There are many two types of the hemorrhagic stroke, the intracerebral hemorrhage and subarachnoid hemorrhage. When we study further these two categories, especially the first one, intracerebral hemorrhage, can further be divided into smaller categories depending on the location of the hemorrhage. The intracerebral hemorrhage, ICH, is a global problem. It affects more than 1 million people every year. The mortality rate of ICH is very high. It's up to 40 to 50%. Even another half of the survivors, most of them are also become disability after stroke or kinds of impairments after stroke. Only 10% of them will recover completely. Less than 1/3 of the patient will functionally independent after experiencing an ICH. Most patients that are suffer from ICH are presented with hypertension, and most of them, in most common situations, the blood pressure is not under control. So in order to prevent ICH, we always need to monitor and keep the blood pressure under control. The typical symptoms of ICH: abrupt onset, consistent severe headache, usually awake the patient, nausea, weakness, hemiplegia, visual changes. Most of these symptoms are due to the changes of the pressure in the brain. In the CT scan, the bleeding presents as the light area, bright light area, and then that's why in the CT scan, that's why a patient presents with stroke, or when you suspect the stroke, you need to prescribe the CT scan for the patient, because you can see even from the first seconds from the bleeding, you can see the bleeding in the brain. But from the ischemic stroke, you won't see any changes in the first 24 hours. So it is very important to exclude bleeding from the CT scan. Many different factors may affect the outcomes of the ICH, such as the volume and the location of the bleeding, the swelling, the age of the patient, the GCS score on presentation, the intraventricular extension, anticoagulant use, the low LDL-C levels. So these are all may affect the outcomes of ICH. And the secretor, the most common secretor, the movement impairments, they impair the speech. So this speech disorder, hemiplegia. According to the National Stroke Association, only 10% of ICH patients may recover completely, 25% recover with mild impairments, 40% will experience moderate to severe impairment, require special care. 10% require care in the nursing home or long-term care facility. 15% will die shortly. So from these statistics, you will see that more than 60% of the patient won't be able to recover independently. Many patients may present as sudden headache, especially severe headache. Some may present as eye pain, nausea, drowsiness, stiff neck, seizures, loss of consciousness, weakness. The diagnosis of ICH mostly rely on the neuroimaging. So in this situation, most of the situation the patient will be in the hospital. If the patient is not in the hospital, we also will advise them to must go to the casualty. These three images will mainly help you to identify the location as well as the differences, the different appearance in different type of examinations. For ischemic stroke, in the CT and MRI scan, in the CT scan, you will see a darker area. In the MRI scan, you can see a bright area. That's why for ischemic stroke, the MRI scan is much easier to locate which part has been affected, even here. In the CT scan, in the first 24 hours, you won't see the affected area. The hemorrhagic stroke, the bleeding in the CT scan, see the brighter area. So you don't mix these two, one is from MRI, one is from CT. Because in the first 24 hours, in the CT scan, the stroke there will be no change in the brain. So that's why the CT scan is very important at the beginning. You need to exclude the bleeding, because the bleeding, you can see immediately the bright area. There are some physical examinations that can be conducted to assist our diagnosis, such as the pathological reflex. The CT scan is suggested to be conducted at the beginning to exclude bleeding. The CT scan also is suggested in a few days, so the patient can have the CT scan done again after a few days to see if there's any changes, even from bleeding, to see if there are any changes from the bleeding. So the CT scan is suggested both with ischemic and hemorrhage. The MRI scan also can be prescribed to see the location is also more accurate, especially for the ischemic stroke. And the MRI scan can indicate clearly. The MRA is to see the circulation. Other lab studies, such as the tumor marker, and also other examinations that can be done in the hospital. For stroke, it is very important to differentiate ischemic and hemorrhagic stroke, because the treatment principles will be very different. Apart from these two types of stroke, a patient suffers from hemiplegia or presents as stroke symptoms. It is also very important to exclude the tumor, so intracranial space occupying lesions. We need to exclude if something extra is growing in the brain. That's why we need to do tumor markers. Don't forget about the brain tumor. These will affect the conventional medicine treatments. This also will affect acupuncture treatments. On MRI, the bright area, this is ischemic. Similar to the ischemic stroke, we have a very brief introduction, the background of the hemorrhagic strokes. Now our discussion will focus on acupuncture. There's also one very similar question, that's when we can apply acupuncture in this situation. In this situation, acupuncture also may be applied once the situation is stable. Especially the blood pressure is stable. But when I say so, I have to admit that the reason why we apply acupuncture or Chinese herbal medicine only when the situation is stable is to avoid the debates from different treatments. If the patient accepts Chinese herbal medicine or acupuncture treatment at the beginning, you can apply it at the beginning, but just to avoid debates and to have a safe practice, it is safer for practitioners to apply acupuncture once it's stable, to avoid further inconvenience, especially during the treatment that the situation become worse. Whose responsibility? Let's also begin to introduce in one case. So it is very important that we understand the situation, the effects of this disease. For stroke, patient suffer from stroke. This patient may suffer a second stroke within 1 month. In this 1 month, sometimes the patient still within your treatment. We're going to introduce another case afterwards, after the introduction of the acupuncture treatment. You will see this patient. We apply acupuncture. After 2 weeks, the patient suffer from stroke again, become unconscious again. So it is very important to tell the patients or the families or their families in advance that this patient may have a chance to develop a second stroke even with the treatment. And then they will understand that once, just in case, if this patient presents with stroke, presents with a second stroke, they won't blame on your treatments. Because sometimes the patient, they don't know acupuncture. Although we can be very sure that the acupuncture won't induce the second stroke. The second stroke is from the disease itself, from the patient itself, but sometimes it's very difficult to explain. So we need to warn the patient or the families in advance. We need to explain to them, especially in the acute stage. So how do we understand the stroke in Chinese medicine? From the symptoms of a stroke, the sudden onset, deviation of the face or the tongue, hemiplegia. All these symptoms that present as something moving, so something in the not the correct position, so they move to other area. So this moving is the characteristic of wind. So the Chinese medicine theory for stroke, we emphasize the wind, and then the wind the wind may be the cause. It also may be the result. Where does the wind come from? This wind can be the exogenous wind. It also can be the endogenous wind. Endogenous, the internal wind, made from the fire, made from the inefficiency, made from the heat, made from the blood deficiency. So for the internal wind, I want you to revise the contents in the basic theory. Where does the internal wind come from? Although there's no stroke, the term of stroke in 黄帝内经, but 黄帝内经described the symptoms of stroke. It described the reason, it explained the reason why the patient suffer from diseases, the half part of the body. The half part of the body is the hemiplegia. We also described in Ling Shu, the second volume, that where does the wind come from? It says that the antipathogenic qi disappeared, and then the pathogenic qi remain in the area where the antipathogenic qi stays. So this, no matter from which clause you emphasize the wind, but this wind, is it from exogenous wind or endogenous wind? From the internal wind. That's the development from the Chinese medicine. Previously, at the beginning, we more focused on the exogenous wind. And then as the theory develops, and then especially about 6th or 7th century, unconsciousness develop into the internal wind screw. Also from the other presentations, we can see the phlegm dampness, and heat. Sometimes they can combine. The heat can make the phlegm and dampness worse. So in a patient, they may present as greasy tongue, thick greasy yellow coating with a dampness and phlegm. Unconsciousness. The patient also may, when the patient presents unconsciousness, so that the mind has been disturbed. How can you disturb the mind from the stroke? I want you to think about the image that we use in the basic theory, the fish and the water in the pot. The fish is the heart mind, the water, the yin or the blood. So the unconsciousness, the heart mind blockage, is the fish is not moving anymore. So what happened there? It can be the phlegm. The water becomes sticky, so the heart mind cannot move. So the unconsciousness. There also can be there's no fish, there's no water, lack of yin, lack of fluid. So these are different pathogenesis in Chinese medicine. Although at the beginning we introduced the backgrounds from conventional medicine, when we're talking about Chinese medicine and acupuncture treatments, we need to explain from acupuncture theory, from the Chinese medicine theory. Otherwise, you won't be able to apply the treatment. For example, ischemic stroke, a blockage. That's all what you need. But how does this happen? Our treatments, although the treatment principle will be activating the qi and blood, but how to do that? It is very important to understand the etiology, the causes. Once you understand the etiology, you also can advise the patient how to prevent the second stroke. If this stroke is an overweight patient, if due to improper diet, greasy diet, develop into phlegm, greasy thick coating, then you can advise the patient to change the diet that can prevent the second stroke or to maintain the future health. Excessive emotion, liver kidney yin deficiency. These are where the internal wind comes from. So for the pathogenesis, the stroke is mainly the obstruction of the meridians of the brain or the heart. So our treatment may focus on these aspects. That's something you can think about when you see a patient. It can be the hyperactive yang, which means it's the yang deficiency. Yin deficiency results in hyperactive yang. It also can be the heart fire, the excess fire. But when we see a stroke patient, we think about excess, we also need to think about the deficiency. So always from yin and yang aspects, always think from both sides. The symptoms of the stroke are very similar, actually exactly the same as the introduction in the previous videos. Sudden falling down, acute onset, slurred speech, deviating mouth, or drooling, hemiplegia, conscious or unconscious. In acupuncture, we separate these two in we separate stroke in two categories, attacking the meridians and attacking the zangfu organs. This differentiation was developed in Shanhan Zaping Lun. The author Zhang Zongjing divides the stroke into these two aspects. Attacking the meridian presents as hemiplegia, slurred speech, deviating mouth without loss of consciousness. So this patient still conscious, but presents as symptoms that in the physical body, attacking the 脏腑 organs. The patient will be loss of consciousness, actual sleeping, hemiplegia. The patient also may present as the above symptom from the meridian, but the main difference between these two different symptoms is the consciousness. The attacking meridian, the patient is still conscious. Attacking 脏腑 organs, the patient will lose the consciousness. Attacking the meridians, there are different causes of this syndrome, such as the hyperactive liver yang, phlegm blockage, phlegm heat, qi deficiency, and blood stasis indeficiency. These subcategories are from the different symptoms, different presentations from the patient. Whereas these symptoms, we actually put different symptoms in groups according to the theory in the diagnostics. That's why if you understand the theory, the basic theory well, if you understand the diagnostic well, it will be very easy for you now, because such as the hyperactive liver yang, or what we do in stroke differentiation, you need to give me or you need to memorize the main symptoms for specific disease, and then you add on the disease, the manifestations that's due to this category, such as the liver yang, something related to eyes, dizziness, headache, irritation, the liver emotion, poor temper, bitter taste, dry throat because of yang, yellow urine because of yang, constipation because of lack of body fluid, also due to the heat, red tongue or deep red tongue, yellow dry coating, or yang symptoms or fire symptoms. Phlegm heat, very similar. Perfumed phlegm, sticky mouth due to phlegm, abdominal fullness due to phlegm, red tongue due to heat, yellow greasy coating due to heat and phlegm, slippery pulse, phlegm. So when we see a patient presents with these manifestations, we're going to work from the other way. We're going to see the symptoms first, and then we're going to conclude to syndrome. Affecting the 脏腑 organs, loss of consciousness. So this patient must be loss of consciousness, accompanied by blockage syndrome or collapse syndrome. So these two are two different categories. Blockage, excess syndrome, red complexion, fast breathing, wheezing, closed mouth, spasm, constipation, difficult urination. Collapse syndrome, pale complexion, weak and soft breathing, open mouth and hand open, sweating because the qi cannot confine the fluid, cold extremities. So as you can see from here, these two categories are actually two, one from yang, one's excess, one's deficiency. The collapse, what's collapse? Yin and yang. The treatment principles: activating the qi and blood circulation for the attacking meridians, unblock the meridian. 226, 220, pericardium 6, heart 1, lung 5, blood 40, spleen 6, stomach 36. These are the basic formula. These are very important. You can use all of them, or you can choose the majority of them. And then due to hyperactive liver yang, you can add liver 3, kidney 3, tonify the kidney and liver yin. Due to phlegm blockage, you can add stomach 40, large intestine 4. Due to phlegm heat, you can add large intestine 11, stomach 44, stomach 40. The stomach 40 is very good for phlegm, no matter visible or invisible phlegm. Large intestine 11 is good to clear the heat and activate the circulation. Due to qi deficiency, you can add Rong 6, spleen 10. You also can use Moxibustion, or the combination of needling and Moxibustion. Due to wind, you can use kidney 3 and GB20. Due to kidney 3, you use kidney 3 is because you want to tonify the yin to stop the wind. GB20, Feng Chi, we have mentioned quite a few times now. Feng is the wind. So it's very good for anything related to wind. Accompanied with the mouth deviation, stomach 6, stomach 4. Impairment of upper extremities. So these are some choices that you can consider. When you see this group of prescription, you will see there are many points. In one patient, in one treatment, we don't use all of them. You will select the most important ones, and then you can apply. If you treat the patient quite often, such as once a day, then you can use 2 or 3 groups. Every day you use, for example, today you use group 1, tomorrow you use group 2, the third day you use group 3, and then on the fourth day you use group 1 again. And the points in these groups, you can use the similar ones and you can change a little bit. So it doesn't have to be brand new in different groups. Needling technique. Group 16, we use the bird packing. Group 20, pericardium 6, reducing manipulation technique for 1 to 3 minutes. When you perform this kind of technique, you also need to always communicate with the patient. If too painful, you need to relax or stop for a while and then start again. Spleen 6, and stomach 36, we use reinforcing technique. Attacking the 脏腑. For the blockage syndrome, you need to open the orifice, clear the mind. Collapse syndrome, restore yang qi, focus on moxibustion with reinforcing technique. The main points are very similar. Do 24, so do 26, do 25, do 20, pericardium 6. Why we need to focus on do meridian is because do meridian is the seat of yang meridian. For the blockage syndrome, we add Acupuncture 11, large intestine 4, level 3. Collapse syndrome, room 4, room 6, room 8, we can use Moxibustion. Pericardium 6, reducing technique. Actual UE 11, cause bleeding with 3 edge needles. Room 4, room 6, you can use Moxibustion. The Moxibustion till the extremities become warm. You can keep Moxibustion, so this sometimes take hours or tens of hours. Room 8, Moxibustion with Fuzi, also till the extremities become warm. The electrical stimulation can always be applied in these situations. And the scalp acupuncture is very important in the treatment of stroke. you can always refer to your textbook. There's the different locations of the skull acupuncture, which location for which problems, which and it is very important that you should encourage the patient to move the affected area during the treatment. But sometimes it's very tricky. The patient cannot move because of hemiplegia. So what you can do, what I normally ask the patient to do is, even though they cannot move the extremities, it is very important they need to think about it. Try to give orders to the extremities, because the reason why they cannot move the extremities, one is from the stroke, that's they cannot move the muscles. The second is don't they don't give the order. They are not used to give the order to the muscle anymore. So they need to think about the moving. You need to ask them to try to give order to the extremities, the affected extremities, especially during the treatment. So that's what you can think about. So that's what you can advise. In this video, we mainly discuss the ICH and as well as the treatment from acupuncture of the stroke. In the next video, we are going to introduce a few cases for the stroke treatment. Thank you for your attention.